Welcome to episode 1 of Cannabis and Company. I'm Jamie Cooper and the founder of Cannabis Connection. Today I'm joined by Kathleen Graham and Karen Korn of Leaf Medic. Thanks for joining me today, ladies.
Thank you for having us.
Thanks for having us.
It's awesome having you. So first of all, let's get into business. Tell us a little bit about your business and the services that you offer here in Michigan.
So Leaf Medic started as a proprietary school in the state of Ohio. I started it. I have a background as an academic head for a small vocational college, and it was actually in the graphic design industry. But when I left that school, I decided that I wanted to start my own school. And so I did that in Ohio when Ohio was launching their medical cannabis program. And I created along with a couple of friends of mine, a course that would train dispensary workers in Ohio. And then through a series of very fortunate events and the folks at the Ohio Cannabis Chamber of Commerce, I met Kathleen. And then she and I started to talk about how we could blend our programs, our services, and bring them into Michigan, as well as bring what she had to offer further into Ohio and begin to offer some of her services here. So we applied through the proprietary school licensing corporations portion of LARA. I just did not name that organization right. It's a long name. But through LARA, we went through the proper process of getting Leaf Medic licensed as a vocational proprietary school in Michigan. And we were successful with that. So we're the first licensed and approved school in the state to offer this type of training. We would love the opportunity to submit this training to the folks at the Marijuana Regulatory Agency so that they could review it and see if they would deem it appropriate as sort of a foundational training for people who wanted to come and work in the industry, particularly in provisioning centers. That's the segment of the industry that Leaf Medic targets. And so then when we joined forces with Kathleen, we were able to open up even further what we would have to offer in terms of services. Initially, like I said, it was employee training that Leaf Medic set out to accomplish, as well as continuing education for employees, and then a little bit of patient education that went with that employee training, but patient education really wasn't our focus. And so then when Kathleen joined us, we were able to expand that, and I'll let Kathleen talk a bit about the services that Cannabis Nurse and Kathleen S. Graham intricate offer.
Okay, awesome. Yeah, and Kathleen, you and I have known each other for what, about 4 or 5 years now?
Yes, a long time, a long journey, a great journey too.
Great.
I look forward to creating more great memories with you. I got into this because I was a hospice case manager, and the people coming into hospice care were utilizing cannabis, and as a medical professional, I wanted to know how it was reacting to them and interacting with the medications I was giving them. I saw some of their struggles, and so that led me to Lansing to advocate for the bills for pure, consistent product with an active ingredient list. And then I continued to see the lack of education for both in the patient field and the medical professional field. So I developed Cannabis Nurse, which created a little booklet for patient education and offers continuing education credits for medical professionals, or specifically nurses, on the topic of cannabis, so that they can better take care of the patients that come into our field that utilize cannabis. And in that journey, I met with Karen, and through a gentleman named Tim. It was a wonderful introduction, and so we since had our marriage, and we collaborate together to provide across the board training for employees, education for patients, and education for medical professionals.
I love that you just called it a marriage, because isn't that truth when it comes to business partnerships? It's pretty much like a marriage.
Yes.
Absolutely. We took our time in creating this relationship, in building this relationship. And carefully considering how we were going to name our companies and how we were going to sort of sandwich together the services that we offered, but also allowing ourselves autonomy. And everybody else that we continue to partner with or collaborate with going forward, we hope to be able to do the same thing. That was something that was really important to both of us. So we looked at this sort of like a marriage, where we're both willing participants going in, bringing in our, things that we have to offer to the relationship, and then hoping to each become better as a result of it. One other thing I wanted to point out is that Leaf Medic offers exclusively our training is offered online, and it's delivered through your cell phone or through a laptop. And so because we occupy that digital sphere, we hope to be able to reach people in places that it's hard to travel to go, say, to a college or something to take classes. But the nice thing for us in Michigan is that Kathleen is feet on the ground in Michigan. I do live in Ohio, but Kathleen has spent years educating people face to face. And so that's a really wonderful component for us in Michigan, to have Kathleen there and having had certs for so long in the cannabis community.
Wonderful. Well, so what does the Michigan Marijuana Regulatory Agency require as for like requirements for provisioning centers, and how does your organization educate employees?
So according to the emergency rules for adult use, which are published currently, there are a couple of different rules that address this specific need. And we have attempted to, in building our curriculum, go through and comb every single bit of the revised code and the law that we can to make sure that we are training people properly per the regulatory requirements as they're established. Now, of course, these are emergency rules, and everything is not set in stone, I think, at this point. But rule number 56 says that provisioning centers are required to, quote, train employees and have an employee training manual that includes, but is not limited to, employee safety procedures, employee guidelines, security protocol, educational training, including but not limited to marijuana product information, dosage and purchasing limits if applicable, or educational materials if applicable. The employee training manual shall include a responsible operations plan as specified in subdivision G of this subrule. It also says that provisioning centers must establish point of sale or transfer procedures for employees at marijuana retailers performing any transfers or sales to individuals 21 years of age or older. The point of sale or transfer procedures must include, but are not limited to, training in dosage, marijuana product information, health or educational materials, point of sale, purchasing limits, CBD and THC, serving size, and consumption information, including any warnings. And so we provide both that training and education through our services in an attempt to satisfy these requirements. But in different municipalities, there are more elaborate and detailed requirements in terms of the training and education that within that municipality, provisioning centers are required to fulfill or establish that they have met those requirements through various documentation processes.
Great.
I would like to also say that even though the adult use has these emergency rules in place, the medical has their permanent rules in place, and the education is identical. So there's nothing to indicate that they would change from the emergency rules and the adult use to the permanent rules when they come out, because the same thing is in the medical rules.
Okay. And so how do you see, Kathleen, both of you and Leaf Medic, contributing to the industry's future as this continues to progress over time?
I think our biggest goal is to improve outcomes and reduce harm for patients that consume cannabis, or people that consume cannabis. I know that there are a lot of different types of cannabis out there, and they're not all created equal. And it can be overwhelming for a patient to go in to a provisioning center to pick out a type. And then if they get the wrong type, they've wasted money or they've had adverse reactions. So our goal is to educate the point of sale staff and the patient or consumer purchasing it. So again, that we can minimize harm and improve outcomes so that they have a good journey with cannabis.
I love that. That's so important on the medical side. You know, like people really need to be aware that everyone is different, and every strain, dependent on how it's grown, its soil conditions, lighting conditions, can be different. And so it's important to have, you know, medical professionals like yourself, you know, weigh in on this topic. Karen, I think you were about to say something.
I was just going to say it's absolutely true on the medical side, and that's all that we have currently in Ohio. And so, having developed our programming in a medical state, of course, that's, you know, where our point of origin comes from. That's where we start. But even if you begin there and then you move into an adult use market, if you visit Colorado, if you visit California and you go to a dispensary there, you will find that people are seeking in the legal market a curated experience, meaning they want to be able to be experiencing their product or taking in their product through various forms, and they want to be able to, in the morning, for example, be awake and have their cannabis medicine help them, you know, be productive during the day, and then in the evening, they do not want to also be awake. They want it to be able to, you know, be compatible with going to sleep. And so there are different products, we all, you know, who are relatively aware of how cannabis works, that facilitate either of those states. And so, you know, I really believe that all of the information, all of the knowledge that has been developed so far in the medical marketplace, or portion of the industry, will be helpful for adult use consumers who are looking to just not take what the guy that they know has, you know, who are looking to experience legally accessible, regulated cannabis that give you more, hopefully. I think that's most people's hope.
Right. And I have to say that it was adult use in Colorado, me living in Colorado, adult use that made me kind of start becoming a consumer. And then I stopped and I realized how much it was helping me medicinally. Like,
interesting. Yeah.
Yeah. So, you know, there seems to be this huge gap between cannabis consumers, those that grow the product, and medical professionals. You know, I'm often hearing stories of people going to their doctors. Doctors don't know anything about it. They're trying to get information from medical professionals. If you could teach every medical professional 5 things regarding medical cannabis, what would that be?
I think first and foremost, not all cannabis is created equal, that each variety has its own unique ingredients, and educating people about those ingredients and the differences between the cannabis will help improve outcomes. And again, like Karen mentioned, there are some varieties that help keep you awake and focused, and other varieties that give you that couch lock effect that help put you to sleep. That adverse reactions are real. Educating a patient that to start small and go slow is critical, because some high strains of cannabis can increase heart rates, and cardiac patients need to be aware to avoid these specific types of strains. There is such a thing as cannabis poisoning. It is similar to alcohol poisoning. It is when your body has too much cannabis, you can have adverse reactions to that. And there are things that you can do to minimize that. And first and foremost is what Dr. Uma says, and that is hydrate before you medicate. And then know your dose, know what to take, and know how it's going to react to your body. Knowing the pharmacokinetics, or the way that it's metabolized, is really important. Knowing that when you consume an edible, it can take up to 2 hours before you feel the effects, so that when you're safe not eating that second cookie, so that you know, okay, if I eat that second cookie or that third cookie, I might experience what we in the medical profession call cannabis poisoning, or what we call outside the medical profession kind of just over medicating ourselves on cannabis. It's not fatal by any means, but it can cause a lot of dysphoria, which can lead to nausea and vomiting, being lethargic, having irregular heart rate, and feelings of panic or psychosis. And we don't want our consumer to feel that, that's for sure. The next is that there are drug-to-drug interactions The first and foremost is blood pressure. Cannabis naturally is a vasorelaxant, and it can naturally lower your blood pressure. So having somebody that is on blood pressure medications, it's important to educate them to monitor their blood pressure, or at least separate their cannabis medication by at least 2 hours from that blood pressure medication. And there are a number of other medication interactions, but I would encourage you to come onto our site and learn more about them. And then cannabis can also help decrease your blood sugar. So I would again encourage you, if you start using cannabis, to monitor your blood sugars. And that's about all for that I can remember for the warnings and what to educate about. But there's so many more and so many fascinating things to learn about cannabis.
There absolutely is. That's great. Those are great suggestions, and maybe us as consumers can start educating our medical professionals as well, and so where do people find information about Leaf Medic, and where are the best ways of them getting a hold of you?
So we have a website, and that website is actually michigan.mmjtraining.com, as in medical marijuana training, or just MMJ. And that site is specific to the Michigan market. On that site, you can link to Kathleen's site, and she has an additional site that is cannabisnurse.com. Kathleen had a business as Cannabis Nurse for a long time before we had our marriage. So that's why we say that we're both Leaf Medic, but we're actually, Leaf Medic and Cannabis Nurse / Kathleen Graham Integrative Education. I cannot say that word. I've done it twice trying to say that word. But anyway, so you can go to either of those websites to learn a bit about the services that we offer. And then if that's not sufficient, there's a catalog you can download on our website. That's a school catalog. And but if that's not enough and you just want to talk to somebody, we both have phone numbers listed on our websites. But feel free to email us. I'm Karen at mmjtraining.com. I'd be happy to answer any questions you have about our services.
And again, my website is cannabisnurse.com, and my email is kathleen@cannabisnurse.com. And again, my phone number is listed on the webpage. Feel free to reach out to us. We'll be happy to answer any questions you guys might have.
Well, it's great having you both here. Karen Korn, Kathleen Graham, really, really appreciate your time today and helping us understand what you do and the services you have to offer.
Thank
you so much.
And thank you for joining us for Cannabis and Company. We will be back again next week with another topic. Thanks for joining us.
Bye-bye.
Bye.